Today, I'm going to show you how to increase your lowest grade in nursing school by over 10% with our 5 proven test-taking tips for nursing students. In fact, these are the same strategies I teach to over 250,000 nursing students inside our NRSNG Academy test-taking course, where 50% of NRSNG students saw their lowest grade improve by an entire letter grade and 25% saw it improve by 2 letter grades. I'm Tormund.
Gather the elders and let's talk.
I'm John Hawes, RN, founder of NRSNG. And in this video, I'm going to give you my top 5 test-taking hacks for nursing students step by step. So keep watching. Did you know that in 2018, 87,371 nursing school graduates failed the NCLEX RN? That's more potential nurses than there are hospital beds in Alabama, Alaska, Arizona, Colorado, Connecticut, Hawaii, Idaho, Iowa, Kansas, and Kentucky combined. At NRSNG, we have a 99.42% NCLEX pass rate. The difference? It's our process. And today, I'm going to share with you 5 of our best test-taking strategies. Now at the end of this video, I'm also going to give you a cheat sheet with 11 test-taking tips, and I'm going to jump on the computer and do some practice questions for each of these tips. So hang on till the end. All right, let's kick these 5 tips off with tip number 1, which is understanding nursing priorities. Priority nursing questions can be terrifying as a nursing student, but think about it this way. When you show up for your first shift as a nurse, you're going to have a task list that's 3 miles long of things to do, and they all need to be done now. So let me show you how to answer nursing priority questions and think about priorities in your real life as a nurse. The most common tool taught to nursing students to address priorities is Maslow's hierarchy of needs. Now, while this is super thrilling to learn, I want you to forget about it when it comes to nursing priorities. Don't tell your professor. Instead, we're going to use what we call the ABC's DEF staircase, which stands for airway, breathing, circulation, safety, discomfort, education, and feelings. This simple mnemonic will help you remember the proper order for your nursing priorities. If a patient just fell out of bed, but they aren't breathing, do I worry about getting them back in bed or educating them on proper call-out use? No, I worry about their airway and their breathing. Now with that, it can be tricky to remember the difference between airway and breathing. Think of it this way. Airway means getting air into the lungs. Breathing means gas exchange of that air. One area you might get tripped up with nursing priority questions is when to call the provider. These answer options can be tempting because sometimes we'll think, well, I don't know what to do. Let me just call a provider and let them worry about it. But there's a better way to approach these options. Anytime you see call the provider as an answer option, think, if I leave my patient's room right now to go call the provider, what happens to the patient? Is there something I can do within my nursing scope of practice? And if I don't do that and leave, what happens to them? Don't call the provider until you've done everything you can within your scope of practice to make sure the patient is okay. Now it's time for the second tip of this list, the SATA success pyramid. SATA stands for select all that apply. You know, the ones that say select all that apply and then have 3,000 options listed. For many nursing students, these are the bane of their existence. But have no fear, SATA questions can be answered very easily using the SATA success pyramid. And it's a super simple 3-step process. When you realize you're answering a SATA question, the first thing that you do is you cover all the answer options, whether with your hand, a piece of paper, whatever. Then you evaluate each answer option individually, physically moving your hand down or your paper or whatever it is. Lastly, as you evaluate them, you turn each question into a true-false statement. Where most nursing students fail with SATA questions is they read answer option A and think, well, that's really similar to B, but it's also kind of like C too, so they begin trying to force answer options to work together. When you isolate each option and make it a simple true-false statement, your success rate for SATA questions will skyrocket. Now, Are all select all that apply higher level questions on the NCLEX? Well, yes and no. While it isn't required that SATA questions be higher level of difficulty, generally speaking, SATA questions are going to require more analysis level thinking, which is the higher level of Bloom's taxonomy. Now, if you're thinking, what is Bloom's taxonomy? Check out this short video, wherever it appears, where we discuss Bloom's taxonomy. Now, don't get too caught up worrying about difficulty level or how many SATA questions you've seen. Just apply the SATA success pyramid on your next exam and watch your scores climb. All right, 2 steps down, 3 to go. I hope you guys are feeling better. I don't ever want you to hear again.
While that is correct, it is not the most correct.
No! What does that even mean? All right, guys, with that, let's jump into tip number 3, which is absolute words. When it comes to nursing tests, absolute words are absolute red flags. Don't pick these answer options. Examples of absolute words are always, never, none, all, and every. If you see one of these words, run. Why is that? It's because no 2 patients are the exact same. It's near impossible to say that you should always do the exact same thing for every patient. Now with that, let me give you 2 exceptions to this rule. If it's a safety issue and it can be applied to many types of patients' populations. And let me give you a specific example of that. If an answer option says, never lift a Foley bag above the bladder. Is this a safety issue? Well, yeah, because we don't want to cause a UTI. We don't want that backflow and cause a UTI. And can it be applied to many kinds of patients? Do we lift a Foley bag above a pediatric patient? No. How about on a geriatric patient? No. It's really that simple. I know you're never going to forget that tip. All right, tip number 4, stay true to the nursing process. You might hear the nursing process slightly different from what I'm going to share with you, but essentially, any way you hear it, it's saying the same thing. Assess, diagnose, plan, implement, and evaluate. Never break this process, ever. Never, never, ever. Now, I don't want you to overthink the nursing process. This is basic stuff. It's really the scientific method you learned in elementary school, but we're just applying it to nursing, and we use it in our everyday lives. Look at an example. I wake up in the morning and check the weather. It's cold, so I plan my outfit. I put a sweater on, I go outside, and it's a bit warm, so I start the process over. Change my outfit. It's really the same with nursing care. You don't skip a step in the process. Don't start doing things on your patient until you've assessed, made a diagnosis of the situation, and made a plan. I'm not going to beat a dead horse on this tip, but just learn to appreciate the nursing process and the structure that it provides to you as a nurse, and remember to never skip a step. Never, ever, no matter how good an answer option might appear. All right, lastly, tip number 5, don't fall for NCLEX question traps. Every now and then you're going to come across an infamous NCLEX question trap. Look, the NCSBN, who administers the NCLEX, wants to be sure that you're a safe nurse and that you don't cause any harm to a patient on your first day as a real nurse. To do this, they use a couple little traps to see if you really know the nursing process and if you're willing to slow down and make the right decision, not just any decision, to do something for your patient. So here are 5 traps that you can avoid on the NCLEX and in nursing exams. I'll list them and then give you some examples. No assessment, incomplete assessment, first doesn't always mean assessment, action doesn't always mean implementation, and determine the outcome for each answer. Let me give you some examples of these. No assessments complete. I used to see this a lot when I worked in the hospital as an RRT nurse, where I would rapid response team. We would get called a couple hours after blood sugars were checked and insulin was due. A lot of times we would arrive, take the blood sugar, and see that the patient's sugars were below 20, even in the teens, sometimes even below 10, the patient was unresponsive. As we would look at the MAR, we would realize that what had happened is the tech had checked the blood sugars, then a couple hours had passed. The nurse came and administered insulin based on blood sugars from a couple hours ago. No assessment had been complete and the patient was put into danger. Another one is incomplete assessment. An example of this might be, you see a question that says, you're taking care of a diabetic patient, You walk past the room and the patient's shaking. And one of the answer options might be administer D50 immediately. That can be tempting because we want to get those blood sugars up, but we haven't even completed a full assessment. The first thing we need to do is check blood sugars. This patient might be an AFib or they might just be cold. Number 3 here is first doesn't always mean assessment. This is really a semantics thing. We've got to separate our mind from the first is always assessment. While it's the first step in the nursing process, if they say, what would you do first? Realize where you are in the nursing process and what the next action should be. With that leads into action doesn't always mean implementation. With the example I gave before, the first action would be complete your assessment, get a blood sugar. So just separating first an action from assessment and implementation. Then lastly, determine the outcome of each answer. When you read an answer option and you think about selecting it, think, if I do this and then clock out and drive home, what happens to my patient? What's the outcome for that patient? Is it going to be good or bad? And only select those things that keep your patient safe. You can pass nursing exams and you will pass the NCLEX. Inside NRSNG Academy, we help you cut the fluff, improve your exam scores, and feel better prepared for life as a nurse. Click the link in this video and in the description to get a full list of 11 test-taking tips for nursing students and to check out our test-taking course. Now lastly, let's go jump on the computer and I'm going to show you examples for all 5 of these steps. These example questions are coming from a book called Test Success by Patricia Nugent. I highly recommend you head over to Amazon, grab yourself a copy. It's a really great book and it will greatly help you in nursing school. This first question says, what should be the nurse's first action before administering an enema? Verify the physician's order, collect the appropriate equipment, arrange for the bathroom to be empty, or inform the patient about the procedure. All right, what tip can we use here? Well, if we look at first action, we realize this is a priority question. It's wanting to know, do we understand nursing priorities? So we've learned that we can use the ABCs, DEF, and we can also use the nursing process here. So verify the physician's order. Is this an ABC, DEF? Well, yeah, sure. This is a safety issue. Collect the appropriate equipment. That goes into nursing process. That goes into like implementation. Arrange for the bathroom to be empty. If we think ABCs, DEF, that's a feeling thing. We want the patient to feel safe and to make sure that they're okay. And then 4, inform the patient about the procedure. ABCs, DEF, that's education. So our top one here was a safety issue. Then we had feelings, we had education, and we had implementation. So if we go back to our ABCs, DEF, as a safety issue, this becomes the most important one, and we should select number 1 to verify the physician's order, make sure our patient is safe before all else. All right, example number 2, a patient is receiving oxygen by nasal cannula. After morning care, the patient experiences dyspnea and complains of feeling tired. When planning for the patient's bath the next day, the nurse should plan to give a complete bed bath quickly, bathe only the body parts that need bathing, arrange for several rest periods during morning care, or continue with the same plan of care because we don't care if our patient dies of dyspnea, because dyspnea is unavoidable. All right, so let's look at the question here. When planning for the patient's bath the next day, the nurse should plan to. So this is really testing us on our nursing process. So remember, we're talking AD, PIE, assess, diagnose, plan, implement, and evaluate. Which phase of the nursing process is this testing us on? A patient is receiving, the patient experiences dyspnea, feeling tired. When planning for the patient's bath the next day, the nurse should plan to. So we're in the planning phase. This wants to know, do we understand everything that's involved with the planning phase? Give a complete bed bath quickly. That's kind of implementation. Bathe only body parts that need bathing. Also implementation. Arrange for several rest periods during morning care. Arrange, that sounds like planning to me. Continue with the same plan. Well, that's not even a safe thing. So we can cross that one off immediately because our patient's not going to be safe. So option 3 immediately goes back into plan and planning. And we would select that option because it is during the planning phase of the nursing process. All right, let's do one more example. How can the nurse best improve circulation when giving a patient a bath? Apply soap to the washcloth, keep the patient covered, use only hot water, use firm strokes. What immediately stands out to you in this question? The word only should stand out to you. If you remember, we talked about these absolute words, always, never, none, all, every, only applies there as well. We can cross out option 3. So immediately we went from a 25% chance of getting it right to a 33% chance just by crossing out this absolute word. Now, apply soap to the washcloth. That obviously doesn't improve circulation. Keeping the patient covered and using firm strokes. Now we're at a 50-50 chance of getting this question right. Now, the correct answer would be using firm strokes, helping with the circulation, helping the blood pump, and that's going to be the best way that we can improve circulation in our patient. All right, guys, that is all the practice questions that I have for you to quickly apply these strategies and these tips that we discussed today. If you guys want additional help, please head over to NRSNG.com. We've got 6,000 practice questions with the most detailed rationales on the planet. You guys can achieve this. You guys can do this. You're going to become a nurse. And as always, like we always say here at NRSNG, go out and be your best selves today. Happy nursing.